Once I've completed the history, the physical examination, and reviewed your MRI, I'm going to be pretty confident that I know where your pain is coming from, but there are often times where I will not be certain. To reach a level of certainty or near certainty, I'm going to have to perform image-guided diagnostic injections. And the tools we use to complete those image-guided injection procedures are X-ray or ultrasound. Many of the times we're using X-ray. So when you have an X-ray guided procedure, you're brought to a room that looks almost like an operating room. Don't worry, it's not an operation. You're lying down on your stomach. We clean and drape your back to sterilize your skin. And then under the X-ray machine, we're using a needle that is very carefully placed under live X-ray right down to the structure that we are targeting. And we can see that structure with the X-ray. Depending on what we're going after, let's say if it's a joint, the needle is going to go into a joint, and if it's a nerve, the needle is going to go next to a nerve. When the needle's in good position, to further confirm that we have the right spot, we're going to inject some X-ray dye. That's X-ray contrast. And on a computer screen, we're going to see flow of the dye along the structure or into the structure to be confident that the needle is exactly in the right place. Because when you do an injection, not only for safety but for accuracy, you want to make sure that the medication's only going where you want it to. So if you're doing a diagnostic injection, then you want to numb only the structure that you're targeting. You don't want to accidentally get freezing medication on the structures next door, then you're freezing two structures at once, and you're losing the accuracy of your diagnosis. So we use these tools, these X-ray machines and these ultrasound machines, not just for safety, but to make sure that the next step of diagnostic information that we're collecting is actually useful and valid.